All right. Well, thank you, Christina, and thank you to all of you for giving me the opportunity to come in here and speak to you. I truly appreciate that. I also, in addition to being a board-certified nutritionist, as Christina had mentioned, I also am a general practitioner, and I provide nutrition consults on the side as well. Purina is a great company, and they give me the opportunity to be able to work in industry, but they also understand that while I want to work with a population of animals, and that's why I got into nutrition, I also still want to work with the individual animals as well. So, we've all had rather long days at this point, I'm sure. So again, thank you for coming and giving me the opportunity. I'll get into this talk at this point now. So, and if you have any questions, do feel free to ask during the talk or after the talk, and my contact information will be at the end of the presentation as well. In case you can't tell, I tend to talk a little fast. I'm from New York, and sometimes that accent comes out, so I apologize ahead of time if you hear that. And if you don't understand something, just stop me. Anyhow, this talk is entitled Optimizing Nutrition in the Shelter. And providing appropriate nutrition is fundamental to the well-being of any cat or dog, whether they're in the home or in the shelter. However, in the shelter, they may present more there may be a higher prevalence of presenting more in the malnourished state with respect to body condition scoring system. So you may see the underweight dog due to being underfed and or deprived food, BCS1 of 9, BCS2 of 9. You may see on the opposite side of the spectrum though as well, the dog that has been overfed and resulting in a higher BCS as well, 7s through 9s out of 9. And that is considered actually a state of malnourishment, just the opposite side of the spectrum by definition. So you also may see cats or dogs that present to you with clinical signs of nutrient deficiencies, for example, retinopathies due to taurine deficiencies in cats, dilated cardiomyopathies in cats for taurine deficiency. You also may see the puppy that had a calcium excess being due to being fed an adult food. Particularly in large giant breed puppies, some people tend to switch a little bit too early to adult foods when it's highly inappropriate. They just need to continue to be fed puppy foods. And we'll go over a little bit of that, and that may result in orthopedic disease. And then, of course, we're probably all familiar with the cat that's been relinquished to the shelter due to inappropriate elimination around the house. When secondary to urolithiasis, and simply that could be solely treated with a veterinary therapeutic food, or at least as an adjunct to therapy. In any event, the job of the shelter that we're looking for is to feed appropriate nutrition to provide the correct nutrient needs and then optimize health so that the pet can be more adoptable and to make a good recommendation for food afterward to the adopting parent. So what we'll go over today is a nutritional assessment, a nutritional plan, and how to implement that, some differences of cats and dogs as we're aware, and then some tips on optimizing nutrition and then transitioning into a new home. So this really begins with a nutritional assessment, and that has been outlined as of 2010 by AHA in their nutritional assessment guidelines for dogs and cats. If you have the opportunity, I would encourage you to read this paper. And this has been furthered by the Pet Nutrition Alliance, which has the petnutritionalliance.org, and WSAVA, the World Small Animal Veterinary Association.org as well. So a nutritional assessment that we'll briefly go over that's critical to presenting pets to the shelter is first to start with a screening evaluation to get a complete history, including a dietary history when and if possible. So in other words, what are you eating, how much are you eating, is it canned, is it dry, how often are you feeding, etc. A physical exam to include a body condition and muscle condition scoring system that we'll go over in a minute here. And then to ask, questions such as, are we feeding an appropriate diet? Again, a growth food to a puppy or kitten and a maintenance food to an adult. Are we feeding unconventional diets, or is the diet just not known? In which case we'll go over transitioning diets in a little bit here. So unconventional diets would be your typical, the owner decided that they are a vegan or vegetarian, they want their cat or dog to be a vegan or vegetarian, home-cooked diets, raw diets, etc. So those should all raise red flags. Raw diets in particular, as well as it applies to the shelter environment. There's actually multiple studies on this and recalls as of lately due to the FDA Center of Veterinary Medicine study that's going on, is continuously going. But there was actually one paper that showed that dogs that were fed a single meal of raw food that was contaminated with salmonella were shedding salmonella for up to and including 7 days thereafter, and that's a single meal. When you're dealing with a shelter that's more applicable to public health risks because we have folks walking in and out in addition to being a zoonotic bacteria. Medical issues, do we have pets that come into the shelter that present with large bowel colitis, or do we have some that come in with IBD or protein-losing enteropathies where a veterinary therapeutic diet may be more appropriate? Any of the red flags that go up in this screening evaluation deems that they are at-risk patients, and then those would be eligible for what is termed an extended evaluation. So the body condition scoring system, everybody's aware of what a body condition scoring system is, I hope. So this is the body condition scoring system as set up. It is set up by Purina because we were the ones that actually performed the 14-year lifespan study from 1987 to 2001, which was published in 2002 by Keeley et al. In JAVMA. And the result of that study was that dogs that were restricted fed as in comparison to their paired litter mates lived 1.8, almost 2 years longer. And 2 years longer before they needed to be treated for any chronic condition, and 3 years longer before they need to be treated for any for osteoarthritis, which is really saying something when you're talking about a Labrador Retriever. The study was 48 Labrador Retrievers because the lab is, as you know, more predisposed to orthopedic diseases. And that's what changed the ideal body condition score to say a dog should be a 4 or 5 out of 9 instead of just simply a 5. And in fact, as a company, we went back and changed our feeding guidelines on all of our brands of foods to say feed less, which sounds a little strange for a pet food company to say that, but it's the right thing to do. Do note that body condition scoring does validate only body fat stores, not muscle stores, which gives way to muscle condition scoring. But for every unit above ideal, you're dealing with 10 to 15% above, or in the opposite direction, 10 to 15% below ideal weight. It's very simple to body condition score. Every person that works in the shelter, veterinarian, staff, whoever, as well as owners, when we're adopting pets out, should be aware of how to body condition score. So let me just bring this up here. Can we see that?
How to conduct a body condition exam on your dog. The body condition exam focuses on 3 areas of your dog: ribs, waistline, and stomach. Step 1. Check the ribs. Kneel into position behind your dog and run your hands along his rib cage. Can you feel his ribs easily? Step 2. Check the waistline. From behind, gently run your hands down your dog's waistline, from his rib cage to his hip bones. Is his waistline tucking in like the shape of an hourglass? Step 3. Check the belly. While in the same position, run your hands along his tummy from the rib cage back up toward the hip bones. Is his tummy tucking up? By conducting this body condition exam, you can assess whether your dog is underweight, overweight, or ideal.
Okay. I think it's a fair assessment to say that everybody should be able to know how to body condition score and be practicing this on every pet. With the prevalence of obesity nowadays at 60% in households, and knowing that obesity does give rise to other disease conditions, it does warrant everyone knowing how to do BCSing. MCSing, though, is a little bit of a different, thank you. MCSing is a little bit of a different condition scoring, and as you can see here is a little bit of a subjective scoring, but this system has been validated by nutritionists and created by nutritionists like Tony Buffington at The Ohio State University, who just retired, and Kathy Michelle at University of Pennsylvania. And what it's really telling you to do is take your finger and depress in certain areas of the body, like the temporal muscles, the spine of the scapula, the pelvic limbs, and also the spinous processes of the lumbar vertebrae. In a cat, I dare say it's really the spinous processes of the lumbar vertebrae as well as the pelvic limbs that are best to assess muscle condition scoring. And again, every owner should be able to know how to do this as well and be taught it. The reason being is because, as we know, most diseases in cats are a little more insidious than in the dog, and chronic conditions that result in catabolic diseases, kidney disease, neoplastic diseases, undiagnosed diabetes, etc. It's of urgency it's important to know how to do this. By the way, all of these documents I'm speaking of you can find on wasava.org, which is an unbiased nutritional website. They have a nutrition toolkit within there. So those that get red flagged on the screening evaluation then fall into an extended evaluation, and whereas nutrition may have played a role in their condition, and at the same time nutrition may be a part of patient management. This is where we're going to further work up. We have a veterinary intervention, and we may be doing our CBC, Chem UA, T4, and other diagnostics as deemed necessary. So at this point, answer me a few questions, and I know some of you are fourth years, so you may be interested in these boards. What nutrient deficiency would have played a role in the following? Calcium. Taurine. Not electrolyte on this one. Nutrient. Not electrolyte.
Oh, you said non-electrolyte.
But yes, the ventriflexion of the neck is a key one for potassium. Anybody? Thiamine. Okay, so the nutritional assessment then leads into developing a nutritional plan, and that nutritional plan has been set up by the American College of Veterinary Nutritionists that involves animal factors, which we've been speaking of already, dietary factors, which we will speak of, and then feeding management factors. Again, that goes to how much do you feed, what do you feed, is it canned, is it dry, etc. But then the shelter also has specific needs unto themselves. They want to know the availability, the continued availability of the diets they're able to access, the cost of the diets, and sometimes there are staffing limitations as well that play a role. Some nutrition basics we should talk about very quickly that and just to review and get everyone on the same page is we need to talk a little bit about energy and then meeting nutrient requirements because we're providing a diet to meet energy. So resting energy requirement, as you're aware, is the amount of energy I need to maintain myself without doing anything. Perfect balance. Anything above and beyond that would be your metabolizable energy requirement, sometimes referred to as daily energy requirement. So, again, energy is needed for locomotion, etc. It's measured in calories in humans. We refer to it as kilocalories in cats and dogs. And then here's your definition of metabolizable energy out of NRC. Combustible gases, not so much. That's more of a ruminant consideration, but that is your definition. And this is often determined either by feeding trials or calculation. So here's your calculation by the modified Atwater values. You can see that we get our energy from fat, protein, and carb, and fat is 2.25 to 2.5 times more energy dense than any protein or carb on a gram-to-gram basis. You will, when you look at labels of food, you'll see that everything is written in metabolizable energy, broken down into protein, fat, and carb, and everything adds up to 100% in life. I find it to be more accurate to talk in terms of grams because I eat grams of protein or grams of carb. I don't eat percentages. So just be wary of that percentages have their limitations. We want to know how much to feed now that we know what energy is. And that really depends on a few different variables. First of all, genetics. Certain breeds, as we know, are predisposed to obesity, pugs, poms, Labradors, beagles, etc. But also activity level as well. Take that into account. I myself have a pug. She's more sedentary than a rock. So we may not be feeding her any sort of daily energy factor, and that her factor is 1, so she eats RER and she's good to go. And then, of course, life stage. It's well known that, at birth and then during growth, we need more energy. As a dog or cat reaches skeletal maturity, they hit maintenance and their energy requirements drop. If they're being used for breeding or a working dog, then they're going to require more, obviously. And then as they get into the senior and geriatric years, in dogs it goes down. In cats, it actually goes back up again. And speaking of which, when we're talking about skeletal maturity, different breeds of dogs have different transitioning points, and that should be heeded as well to transition. Toy, small breeds, 7-8 months of age, transition to an adult diet. Large or medium breeds, maybe up to 10 to 12 months transition, and then the Dane or Irish Wolfhound is a giant breed, maybe even up to 2 years. How much to feed? Well, there are, as you're aware, I'm sure here, because you have wonderful nutritionists like Justin Schmalberg and Richard Hill, who have drummed in probably RER equations there to you and how to calculate that. Richard Hill is a brilliant man who has done quite a bit of work to further the energy chapters and research for the world of nutrition. We can use predictive equations to do that. However, there's nothing wrong with going with the manufacturer's feeding guidelines on a product, whether it be dry or canned. Use it as a rule of thumb, though. Probably is an overestimation. You can also look, again, on that unbiased website, Wasava, and within that nutrition toolkit, they have suggestions, but you need to know the weight of the animal, the life stage, and then the caloric content of the product that you're interested in. So key points when it comes to energy: feed a measured amount that's appropriate for the animal's life stage. Many shelters will actually have pre-measured amounts, monitor what's consumed, and then the body weight as it goes up and down, and body condition. If they're running status quo and they're in ideal body condition and weight, congratulations, you found that pet's energy requirements. Remember, again, we're all individualized, we're all different, and then adjust as needed. Consequences of underfeeding, though, cannot be stated enough. The loss of weight, the loss of lean muscle mass has been shown to lead to increased mortality as well, morbidity and mortality. And probably if you're having folks walk around in a shelter and see these thin animals, that's probably not good for adoptive purposes. Also immunoincompetence as well. Consequences of overfeeding: they become obese. That may not be good for adopting either. Obese animals tend to have more GI dysfunctions, and not to mention, in a sense of cost, that's waste to the shelter as well. Some more nutrition basics in addition to energy: everybody should be getting clean, fresh water all the time, unless there's some medical reason to withhold for a few hours if there's a medical procedure going on. Protein: there are 10 essential amino acids for dogs and cats, 11 if you count taurine for the cat, but that's not a true amino acid like the others. And then a nitrogen as a total, because again, every amino acid has a nitrogen backbone. Cats and dogs do need a specific amount of nitrogen in general, in addition to meeting the requirements of the 10 essential amino acids. Fat: essential fatty acids such as linoleic and alpha-linoleic acid to help maintain the dermatologic status of cats and dogs. EPA and DHA, as we know, are the omega-3s. Those are going to be considered essential fatty acids as of 2016. AFCO's finally caught on to that, thankfully. Vitamins and minerals as well. And many people want to ask about carbs. Carbs are not a dietary essential. Carbs, though, in the most basic sense, can be split into starches and fibers, where starch is providing a readily usable source of energy so that the protein in the diet can then be used for cellular turnover of carrier proteins, transport proteins, etc., and also preservation of lean muscle mass. Fibers, on the other hand, may be used in a therapeutic sense. If you have a dog that presents at the shelter with a large bowel colitis, maybe we want to be feeding more of an insoluble or mixed soluble fiber diet. I have this noted on here of this picture with the cats and dogs. Do keep in mind that you want to feed a species-specific food. Cats cannot eat dog foods. It doesn't meet the requirements of a cat. A dog can eat cat food, but shouldn't eat that as the sole diet, because cat foods tend to be more energy dense and exceed nutrients. However, cat food, I myself am guilty of, and it's not a bad idea sometimes to use a little bit of cat food to coax feed a dog to eat. Just shouldn't be the diet overall. So how do you select a food? Again, species appropriate, make sure it's life stage appropriate as well. And it starts off with saying we should be feeding a complete and balanced diet. Complete in that we have the correct quantities of the essential nutrients, 36 in a dog, 40 in a cat, and that it's balanced in the proper ratios. So while you may have, probably the most easy one to relate to is calcium and phosphorus. Your minimum requirements are here, and you have this much calcium, congratulations, you've met the minimum. But you have this much phosphorus, yeah, you've met the minimum. But now that ratio is out of whack and you're upsetting the calcium phosphorus homeostasis. So then you will run into orthopedic conditions because of that. So it's not enough to be complete, it also has to be balanced. And in order to start with that, I also recommend to owners to be looking for the nutritional adequacy statement that we often refer to as the AFCO statement. It is in little tiny writing on the bottom of a bag or can of food, and I've blown it up here because you need a magnifying glass to read it. And it starts off, the basis is either we have formulated a food to meet the nutrient profile, or we have done feeding testing trials. And it should say an appropriate life stage. So there are many AAFCO statements, but they come in generally two ways. One is this, and this is what I would urge you to look at and recommend to owners and use in a shelter, is animal feeding tests, meaning feeding trials, using AAFCO procedures substantiate that this food provides complete and balanced nutrition for the life phase maintenance of species adult dog. The other one goes by the written nutrient profile in AAFCO that basically just says, hey, you know what, I have opened up AAFCO to page 161, and I see a dog profile here, and I need 34 milligrams of zinc per 1,000 kilocalories of energy. So I take your 34 milligrams of zinc and put it in, and you're done. And the formulated foods will then submit that to an independent lab, who then says, yeah, you got your food in there, and it goes on the shelf. The problem with it is it doesn't assess for bioavailability. So how bioavailable is that zinc? You don't just put elemental zinc in a diet. You put in zinc gluconate, zinc oxide, zinc picolinate, etc. Whereas a feeding trial will then test and say, okay, in addition to acceptability and palatability of a food, which that's a nice warm and fuzzy. I think if a pet food manufacturer makes a pet food that's not palatable, then that's just a waste of their time and money. But moving beyond that, a feeding trial can assess for performance on the food. It can potentially assess for digestibility if the pet food company is doing that trial as well. And it can assess potentially for the bioavailability and potential for nutrient deficiencies too. The naysayer to this argument is going to tell you, well, who cares? I have formulated my food, and all these feeding test companies, all they do is just use 8 dogs or 8 cats for a feeding trial and go out for 6 months to get a feeding tested food. Well, that is true. AAFCO is the one that sets up the protocol or procedure to do a feeding trial. The pet food company performs it in compliance with those protocols, but that's when you would recommend to an owner to call up the manufacturer using the WASAVA documents that I mentioned earlier in the nutrition toolkit on their website and ask, well, how many cats and dogs do you use? How long are your feeding trials? So I'm rather proud to say that I actually, again, work for a company that did a 14-year study in 48 Labrador Retrievers. We have a facility, a product technology center out at St. Joseph, Missouri, where there's over 600 cats, over 700 dogs that we're working with and leading wonderful, healthy lives. Some of you have actually been there and have seen this in action, and it's quite fascinating. We have what we term the kitty condos out there as of 2011. Pretty special cats, pretty special people that work there. At any rate, I digress, so let me move on here. Feeding a consistent diet is probably one of the most important things in the shelter. We don't want to be bouncing around from diet to diet, even if foods are donated. We need to start comparing macronutrient profiles at that point. We want to have similar protein, fat, and carb ratios there, particularly fat. It takes a while for the gastrointestinal system to alter enzymes to accommodate for fat intake. Without that, we can result in gastrointestinal upset. The more digestible the diet is, and you can look in the product guides for that information, the more you're going to have less to pick up in at the end. A higher quality diet has actually been shown to result positively in affecting behavior in dogs. That was actually shown in a study where dogs were fed a highly digestible diet in respect to protein and fat, and with interaction of humans, was able to positively affect behavior and moderate the hypothalamic pituitary adrenal axis too. It's quite fascinating. Having access to specialized diets, again, for certain animals, maybe you want a hydrolyzed diet for the IBD or protein-losing enteropathy or lymphangiectasia dog. And then in 2010, the Association of Shelter Veterinary Guidelines stated to avoid raw diet specifically. Again, you're dealing with a public health risk here. These are zoonotic bacteria. Maybe a dog may be subclinical for salmonella. However, we are not. And then if you have the public coming in, walking in and out, they could, and if they're coming in with their child that is not fully immune competent, if they're coming in with the elderly, their older parents, grandparents that are on the decline for immune status, you may be playing with a little bit of fire there. So avoid the raw diets and get that history when they present to the shelter. Implementing a feeding plan involves addressing cost, space, and staffing, and that's individualized to the shelter. Feeding frequency, though, for this plan needs to be addressed. Dogs should be fed once to twice a day. I would recommend twice a day. Cats, at least twice daily. They are natural grazers, so they should be fed at least twice daily. And then puppies, again, especially from 8 weeks to 6 months of age, when you're dealing with the toy small breeds, they're more at risk for hypothermia and hypoglycemia. Feed them at least 3 meals a day. Have the discussion about decrease of energy requirements upon spaying and neutering as these pets are adopted out to their respective parents. Logistics of feeding, that's going to involve when do we feed? What time of day do we feed? Some shelters want to feed in the morning associated with cleaning. Some shelters want to feed later in the day to minimize defecation during adoptive hours. And then, of course, there are special circumstances that require customized feeding plans. And also, before I forget, do remember that you don't want to be leaving food out overnight, particularly if there's rodent issues. Store food in a clean, dry place, and be mindful of expiration dates as well. Special circumstances may involve inadequate intake. And what do you do if the pet doesn't want to eat? Are they stressed? Again, stress is, particularly in cats, has been linked to decrease of appetite and then decrease of lean muscle mass, increased morbidity and mortality. Pain, nausea, food aversion, this involves the veterinary intervention, and then eliminating the stressor if known, and coax feeding the pet to eat. Some pets heat the food. Some pets chill the food, actually. I have a renal consult right now that the dog prefers cold food, to each his own. And then offer a different diet. I can't tell you how many times I've walked into an ICU setting where that dog's just been eating canned food his whole life. No one took a complete dietary history, and we keep throwing different dry foods at the dog. Well, the dog has no idea what kibble is and has never seen that before. Feed the canned food, the dog starts scarfing it down. And then, or opposite. And then sometimes a combination of canned and wet, dogs actually prefer a combination, may get them to eat. Fortiflora is a probiotic if you're not aware of it. It has a palatability enhancer in it, and regardless of the GI and immune properties of that product, it can be used to coax feed. I myself have used it multiple times for post-op surgeries, orthopedic, neurosurgeries as well, to get pets to eat and get them on their way to discharging out of a hospital setting. And then, of course, the traditional palatability enhancers would include small amount of broth, tuna water, maybe a little vanilla ice cream, maybe a little bit of yogurt. So, little case scenario here. Getting into refeeding this pet. Say we have a 2.5 kg female spayed domestic shorthair that presents to the shelter. It's a presumptive neglect case, prolonged starvation, and we can tell this by a body condition score of 2 of 9 and with marked muscle wasting. You can see how the cat presented: weak, dehydrated, bradycardic, mildly hypothermic, and hypotensive, and is stabilized by the emergency service. You need to start providing nutritional support. Are there any concerns that you have at this point? Do you just start, what is the protocol to start feeding a pet that hasn't eaten for a while? Do you just start throwing food in there and saying, here, eat? Or are there any concerns you may have? So there is something known, and some feel it's just more of a textbook. I have actually seen this in dogs, cats, and a horse. One horse I've seen it in, and it's known as refeeding syndrome. It's a constellation of metabolic disturbances, and you can see the metabolic derangements due to the insulin release. Everything bottoms out: phosphorus, potassium, magnesium, and thiamine as well. Not that you're measuring that on a chem panel, but there are specialized tests for thiamine and magnesium you can probably request as well that contribute to these clinical signs of cardiac, respiratory, neurologic, and muscular compromise. Graphically speaking, what's been going on is you have a starved pet. They have not been eating, so where do they pull their energy from? They're going to pull it from their fat stores, but also their muscle stores as well. Yes, they do undergo glycogenolysis to pull from the glycogen stores, but dogs probably only have about 24 to 36 hours worth of that. Cats have even less due to their differences in carbohydrate metabolism versus dogs. And then they're going to undergo gluconeogenesis, pull from those fat and muscle stores to form glucose to feed the cells. Well then, which is a very catabolic situation, as you're aware, but then you start refeeding these pets, and you're ramping up to an anabolic situation. pancreas sees that, secretes insulin, and then all of a sudden you have uptake within cells of all of these electrolytes, and thiamine needs to work overtime for metabolism within the liver. So that is what is known as refeeding syndrome, and that's why those clinical manifestations happen. So what would be the electrolyte that would result in potential hemolysis that you may see on a CBC? Hypophosphatemia? Go with potassium again. What about this one? And this one even has driven some criticalists a little crazy. Magnesium. Because magnesium acts as a cofactor for some of the ion channels for potassium and calcium to go through. So when it comes to refeeding syndrome, prolonged starvation case, how do you feed them? And the answer there would be, well, if the gut works, use it, is the old adage. So continue to feed orally if possible. And then if not, then consider at least still doing enteral feeding and do tube feeding, whether it be E-tube, PEG tube, if they're stable enough to place one. Those villi need that nutrition. What to feed? Well, you're supposed to match the metabolic disturbances that are going on at the time, which include pulling energy from protein and fat. So you should be feeding something that's, first of all, highly digestible, but then something that's higher protein and higher fat, low carb. And that would be something like a critical care diet. Purina has CN, Hills has AD, IMS has Max Cal. How much to feed? The rule of thumb is 25% of the resting energy requirement per day, increasing up to 100% on day 4. I myself am more conservative because I've seen it in patients, and I do 25% RER on days 1 and 2, 50% on days 3 and 4, all the way up to day 7 and 8 where I'm at 100%. And then monitoring them, you may want to do a CBC for the phosphorus clinical manifestations of hemolysis. Definitely a chem panel. Doing this every 12 hours for the first day and a half or so, and then following out after that, probably at days 4 or 5. These patients are immune suppressed as well. So, talking a little bit about optimizing immune health here. Again, complete and balanced diet is the key here. Providing adequate calories, and then to optimize key nutrients for immune health. Protein plays a role. Every good lymphocyte needs protein. Certain vitamins, like vitamins A and E, can act as antioxidants, and then certain minerals like zinc, magnesium, and iron act as cofactors for enzymes in the immune system. To support gastrointestinal mucosa and the gut-associated lymphoid tissue, the GALT, probiotics and bovine colostrum have been studied. So the gut-associated lymphoid tissue, that's about 65 to 80% of your immune cells in your body are organized into that GALT. So the immune system and the gut are very linked. In regards to the immune health, probiotics, no one really knows the mechanism of action of how this occurs, but probiotics can modulate the immune system. Some we do know of producing antimicrobial substances. Some probiotics actually have the ability to physically bind up pathogens as well, like Clostridia. But then, of course, there's a competition for nutrients because if the probiotics are binding to the colonocytes, then the pathogenic can't, they starve and die. This is a slide that's showing not all of, but 3 of the studies that have actually been done with Fortiflora, which is Enterococcus of the genus Enterococcus. Other genus of probiotics that have been used that are beneficial are Bifidobacterium, Lactobacillus, and some Streptococcus. So you can see here how Fortiflora has been able to increase and enhance IgA, IgG, and has increased the percentage of T helper CD4 positive cells in kittens. Mike Lappin is an internist at Colorado State University, if you're not aware of him, and he actually did a study with Enterococcus faecium SF68, that is Fortiflora, showing the benefit of reducing the incidences of conjunctivitis in shelter cats in comparison to another group in the same shelter that were not receiving Fortiflora, with all environmental variables and diet held constant. This study right here that I'm depicting on the bottom right is a puppy study where it was able to increase the fecal IgA as well, and statistically significant from 30 weeks on in that study. So the reason I'm showing you that is because fecal IgA is the main immunoglobulin of the gut. That's the local system there for immune system, and we were able to enhance their local immune system, hopefully preventing pathogens in the future. Colostrum is another nutrient, and everybody knows, yeah, okay, passive transfer, 24 to 48 hours, get your colostrum in there before closure. But colostrum also has immune globulins in it, lactoperoxidase, lactoferrin, and these substances are able to activate the lymphocytes within the galt and have been shown to increase IgA locally and release cytokines to cause an increase in IgG as well. So Arlie Reynolds is a PhD board-certified veterinary nutritionist, and he also is incidentally, a 2-time world sled dog racing champion, who works with his own sled dogs, works with other people's sled dogs. He lives in Alaska. I'm sure that's not a surprise. And he fed one group of sled dogs a test diet, the other group of sled dogs a test diet with bovine colostrum. And the reason we're looking at sled dogs is because they're a very good model for stress colitis, because the exercise and the race is the stressor to cause the colitis. The trial protocol went on for 40 weeks, from June of one year into April of the next year, and he looked at markers of immune and gut health during the study. The results of that study, in the beginning of the study in July, everybody gets a canine distemper virus vaccine. And as you can imagine, up until September, everybody's titer is rising. But after that, the control group's titers drop, and then the colostrum groups actually stay steady at a higher level. So the result of this is what we're saying is that we are able to help prime their systemic or enhance their systemic immune system for hopeful future protection of pathogens. He looked at the gut health as well via fecal IgA. Remember, IgA is secreted within the gut, and every enterocyte sloughs every 3 to 5 days. Along with it, it takes its mucus layer, which has the IgA. So to measure IgA in the feces has actually been validated. So here you are, no difference between the two groups, the control group being gray and the colostrum group being the yellowish goldish. No difference in the beginning, and then at the end of the study, you can see the enhanced immune system locally. So through this part of it, we're saying that's the systemic enhancement, and then here is the local enhancement of the immune system due to the colostrum. Everyone should also be aware of how to fecal score. We have these fecal scoring charts. If you would like one, please get in contact with me, and I'd be more than happy to provide them. It provides a standardization so that everyone in the shelter is able to monitor improvement or worsening of diarrhea. Now, continuing along with GI health, we want to prevent or resolve diarrhea quickly, obviously. Probiotics have been used to do that. Prebiotics have also been used, and if you're not familiar with what they are, that is simply they're acting as food for the good bacteria in the colon. Ingredients that you would see on a bag of food would include fructooligosaccharides, or FOS, mannano-oligosaccharides, MOS, inulin, chicory, etc. So all prebiotics are soluble fibers. So we want to minimize fecal waste. Do not overfeed them. Feed them a diet that's relatively low in insoluble fiber. Remember, insoluble fiber is there to absorb water, add fecal bulk, and if you give too much, you're just going to be leaving large volumes of feces around the shelter. Taking a look at probiotics, their job in a sense of GI is to adhere to the colonocytes, again, outcompeting the pathogenic bacteria. They feed off of the prebiotics or soluble fibers in the diet and produce short-chain fatty acids like butyrate, which is the preferred fuel of colonocytes. Enhances epithelial regeneration, cell turnover. You get over your diarrhea quicker, in other words. And they also will drop the pH, because you're producing short-chain fatty acids, they'll drop the pH of the colon ever so slightly, producing in a weak acidic environment, and that is inhospitable to pathogenic bacteria and is actually conducive to the more beneficial bacteria. So you're kind of tipping the seesaw back into balance there. A study that was done with Enterococcus faecium SF68 for a year-long study was done in kittens. 8 weeks of age is when they started feeding. It's a shelter study. Everyone is exposed to the same environmental variables and is getting the same diet. The only difference is this group gets fortiflora supplemented in their food. About 3 months into the study, so 5 months of age these kittens are, a naturally occurring protozoal diarrhea spreads throughout the shelter. That was tritric. And the cats not receiving the Fortiflora, about 60% of them developed diarrhea bad enough to warrant antibiotics, and on average for 45 days they received those antibiotics. The group receiving the Fortiflora, about 9.5% of them developed diarrhea bad enough that needed antibiotics for about 18 days. So I'm not saying they're not going to contract the naturally occurring protozoal diarrhea, but they may not develop clinical manifestation bad enough that they need antibiotics. Scott Weiss is a wonderful internist and microbiologist at the University of Guelph in Ontario, and he published a study back in 2011 where he pulled 25 probiotics over the counter and cultured them and asked the question, do you have what you say you have on your label? Only 4 of them actually did, met or exceeded the label claim, and of those 4, only 2 actually was able to label their product correctly. And that was actually Prostora by Imes and Fortiflora by Purina. My point here is be very careful with probiotics. They are not drugs, so they're not FDA regulated. You want to make sure you're recommending a probiotic that has been validated, tested for the efficacious amount in the intended species of use. And be mindful of how they're breaking down the amounts of bacteria. If we have a multi-strain product, are they saying here's the amount of every strain, or are they saying here's the total amount? Total amount is a little dangerous because that can change from batch to batch and you wouldn't know the difference in the amounts of bacteria. So you may essentially be giving a different product every time you go to purchase the product. You would use a probiotic in all of these instances. Definitely stress. Probably should be recommending a probiotic going home with the owner after the cat or dog is adopted from the shelter. It's a big stressor to be changing the environment. Probiotics can help alleviate some of that stress. Long-term antibiotic therapy, metronidazole, clavamox has actually been shown to be complementary to. And then certainly diet changes. Acute enteritis, and then, as you can see here, puppies, kittens, to promote a stronger immune system and promote normal fecal quality. Prebiotics, as I already mentioned, they are soluble fibers. They act as food for the good bacteria that are already back there. And again, here are examples of those that you will find on a label. To transition to a new home, it's already a stressor to the GI tract. Do consider that probiotic and prebiotic, and minimize the GI stress to the pet. Feed a high quality food. Be recommending a high quality food that is feeding tested. Provide feeding guidelines. Tell people how much the cat or dog has been consuming, and then please don't forget just general rule of nutrition here, don't feed more than 10% of the daily caloric intake as treats. And of utmost importance, teach them how to body condition and muscle condition score. Also, everyone loves to surf the internet. You do, I do, we all do. So recommend the wasava.org nutrition toolkit again. Again, very useful documents on there. You can see the Savvy Cat Owner's Guide to Nutrition on the internet. There's a dog one too. These are 2-page documents, and on the second page of both of them is the same information. Reliable sources, web sources for nutritional information, textbooks, who to reach out to, the DACVN.org for a diplomate, etc., etc. Comments on homemade foods, raw foods, so on and so forth. And at that point, I'm all set. I'll take any questions if you have them. Here's my contact information if you would like to get in touch with me. Thank you very much.